communications unit with the Department of Children's Services. Basically, that's a fancy way of saying I take complaints for the Department of Children's Services. So I know that you guys want my job. It is open soon. This is actually my last day. So, but I'm sticking it out till the end. But anyways, I cover the west side of the state. So I work for central office. I take complaints for the commissioner of the Department of Children's Services. When people email the governor, they come to me, I respond to them. When they email their representatives or legislators, I respond to them. So I know that doesn't sound very nice, but I mean, they can't do it all. So that's why they hired us. So, but I have 39 counties, so I represent all of those. And that's what I've been doing for the last year. Prior to that, I was a facilitator for the department. Can everybody hear me okay? Okay. I was a facilitator with the Department of Children's Services. That just means that I mediated meetings. So whenever a child's at risk of coming into custody, we have a meeting. And sometimes teachers are involved. And it's really great whenever you guys are involved because you guys are important in the lives of children. And you see them more often than a lot of people do. So we're so thankful for the opportunity to come in here. I have some coworkers with me. They're going to speak later. But I'm going to go ahead and introduce them. In the purple here, if you'll wave. This is Kendra Taggart. She's our education specialist. So if you have a child in foster care and they happen to have a 401k, I've been doing insurance things. A 504 or an IEP, I'm so sorry. A 504 or an IEP.
You have a 401k, you want to use it?
Yeah, I do. A 504 or an IEP, and something, if they're not being handled correctly, that's where Kendra will step in. I'm going to actually have her speak a little bit on what she does and how she can help you guys and kind of what you can know about children in foster care and things like that. The next person is Miss Margaret White, if you can raise your hand and wave. Miss Margaret is a team coordinator, that means she's your supervisor. She is over Madison County foster care, juvenile justice, and our Child Protective Services assessment workers. And so she has her hands full as well. This is Leanne Ryle, if you'll wave your hand. She is our regional general counsel. She is our attorney for the Southwest region. All of these people represent Southwest, which are 11 counties. And so she has her hands full as well, representing the department along with 3 other attorneys. 2 right now? 2 right now. Okay. So, yes. The next one is Miss Teresa Harrison, if you'll raise your hand. Yes, you can see it. I would love that. Miss Teresa is the Southwest Regional Administrator. She is the supervisor over all 11 counties. She is, we'll just call her the superintendent of all of us. And so, just to kind of relate in terms. And so, Miss Teresa supervises all 11 counties. She supervises the supervisors. So, she's the person that you want to know. So, Vanika Glenn, yeah, she's our small little one there. Vanika does a good job as well. She is a Child Protective Services investigator, and she'll kind of cover that as well. She's really out in the trenches doing good work. So we're really thankful for all of these people that are here today. And prior to facilitating, I did foster care as well, and I also worked in resource or placement, so with our resource parents. So anyways, that's just a little bit about me. I'm a social worker. I like people, so that's why I do this job. Anyways, today I'm going to talk about DCS in the community. We're working together for the benefit of children and families. And so, again, you guys are teachers. You see everything. You guys are going to be some of the ones who see the abuse that happens, see what happens at home. You see the after effects of that. And we're going to just talk a little bit about who is mandated to report, what to look for, what happens, how do you make a report, and what happens once you make a report. Because those are all really important things. The reason why I came into the complaint department was because some of it was, there were a lot of complaints, and some of it was a lack of communication with our community. And so that's why we're here today, because, we're working together for the same good, for children and for families. And so if we can share that information, maybe there's going to be less miscommunication and more education. So that's why we're here today. I'm going to go ahead and have you turn to the next slide, please, just to the right. Okay, our DCS mission statement: to ensure forever families for children and youth by delivering high-quality, evidence-based services in partnership with the community. Pretty simple, but that's what we're doing. You can go to the next one. Okay, fostering partnerships. Go ahead to need, all right. So a need for community education, to understand the role played in reporting. These are kind of some of our goals today. That's what you guys are going to learn. To be able to identify signs of abuse and neglect. I'm not going to get deep into that because that's a lot of information. I've kind of highlighted in your packet some of those things. And if you have questions, feel free to ask them. But we only have an hour, and abuse is a big deal. So, I can't get too far into that. But go ahead to the next one. A need for partnerships to provide better communication, to ensure no gaps in services and less duplication of services. One of the reasons I think communities really need to partner up is we have a lot of resources in our communities. And, at Christmas time, there are so many different organizations that are giving to people, and it's so great. But a lot of times you have one family that receives a whole bunch of services, and then there's a family here that didn't get them because this family got it from all 6 of the agencies. So if we're communicating about who we're serving and all of that, maybe we can serve everybody a little bit better. So that's just kind of one of my reasons. Another reason, I think of like the Leave It to Beaver kind of days where everybody knew what the next door neighbor's kids were doing, and if one mom saw that the other kid stole something, she's going to call the next mom down and say, hey, I saw your son stealing something, and that's going to work. But we don't really have those communities anymore. But if we can kind of create those partnerships with you all, let us contact us. Don't be worried about the repercussions of contacting the Department of Children's Services, because we need you to. We need you to make reports of child abuse and neglect, because otherwise that child may live in that forever if nobody reports it. Okay, so, and that kind of actually goes to ensure better accountability and to provide opportunities. One thing that's really great here in Madison County are like summer job programs. I think the city of Jackson does that, where they provide opportunities for kids to work that may not have those opportunities otherwise. And so, we can give that information. If we're working together, we can educate people on what services there are. So, all right, so who are mandatory reporters? Go ahead to this one. Professionals required to report. Okay, I could go through this whole list, but if you'll notice, the very last thing says other persons. So that just means anybody is a mandated reporter. So that's kind of scary, but it's the reality that if you have seen child abuse or neglect, know about it, it's your duty to report it. So here it is. Any person who has knowledge that a child has been harmed by abuse or neglect must report. All right, what constitutes abuse or neglect? I'm going to go ahead and point you guys to your work aid. It's the second set of staple papers that you have. Okay, this is what our workers go off of whenever they are classifying things as child abuse or neglect. So we can go to this one.
If you don't have one, see if there's someone near you, but is it this?
Yes, I forgot. Not everybody has them. So, but you guys will get them. I'm going to send, we'll send the email to you all. Okay, so the physical abuse category includes physical abuse and drug-exposed infant and child. All right, the next category, neglect category, environmental neglect, nutritional neglect, medical neglect, educational neglect, lack of supervision, and abandonment. So I think it's important for you guys to know that educational neglect is a thing. So kids are coming to school, we can step in at that point, so to some extent. Sexual abuse category, I think that's pretty self-explanatory. Psychological harm category. And there are explanations in this work aid, so once you see those, you'll kind of get an understanding. And I just think it's good to have this information. Sometimes I think people think that we're, not trying to be transparent, but the thing is we do want to be transparent because we want to communicate, hey, these are things that we investigate. Okay, so child fatality and near fatality category. All right, so what to look for? Okay. If you'll go to this one, it's really tiny, and I recognize that, but maybe you can see some of it. But possible indicators of abuse and neglect. So there are lots of things that you might notice. You might notice that a child, and I'm going to put some disclaimers on this. You might notice that a child's sleeping a lot in class. Sometimes that can mean that something's going on at home. There's a reason why this child is sleeping in your class. Maybe they're getting abused at night. Maybe their parents are fighting during the night. You don't really know. But my disclaimer is, it could just be that this child took his DS to bed with him, and when the lights went out, he opened his DS and was on it the rest of the night. You know, we don't know. So, you know, I took a art therapy class in college, and it was a really fun class. But one of the things that they had us do, we drew some pictures, and like, one was a house, and if you drew, if there wasn't a knob on your door, that meant something about you, and like the location of your picture on a piece of paper, that meant something about you. But at the very end, the teacher said, but sometimes a picture is just a picture. And so sometimes it may just be the tired kid just isn't sleeping because has snuck that under his bed or something like that. But it could be a serious sign. Okay, go ahead to the next one. And I'm providing this stuff to you, so I just don't feel like this is the time to go through all of that with you all. But possible parent characteristics, you know, one thing, we had to call in a referral one time that said, oh my goodness, you have to go to this home. This parent is scratching at themselves and picking, they're using meth. Well, actually the parent had eczema, so you know, like, it can be like not real things. So, but it could be meth, you know. But if they're acting odd, if you know there are other things going on, you know, there are signs, and you guys know those signs. You know when something isn't right. And so one thing that I will tell you guys, it's not your job to investigate. It's not your job to do a drug screen or anything like that. But if you're noticing some signs like that, any of these signs, and like I said, I'm providing this for you, please go ahead and contact us. Let us know. But just remember, sometimes a picture is just a picture. Okay. All right, so how and where do I report abuse and neglect? Remember, everybody is a mandated reporter. Okay, we can go into this slide. This is called a child abuse hotline. It is 1-877. If you guys don't have this, you need this. 1-877-237-0004. I don't know what the policy at Jackson-Madison County Schools is, but a lot of times I know that as far as reporting, sometimes you go to the counselor or to your principal first before you report. I know my
It's just my phone over there, I'm sorry.
Oh, no, you're fine, I didn't even notice. I would suggest you go to your principal just so they know that you have made that report. I think that that's just good practice. And
If you have a guidance counselor,
yeah,
your counselor, I would also.
I don't know what what your policies and procedures look like, but I know some schools have that written into their policies and procedures. So maybe something to look at, but I would still go ahead and let them know that you've made that report or that you're concerned. So. Okay, so complete the online referral form. I will say this isn't probably the best way if it's an emergency. If it's an emergency, you need to go ahead and call the 1-800 number. But this is, if they're not in imminent harm or danger, you can go ahead and do that. You know, if the kid is coming to school, and this sounds awful, but if he has cockroaches coming out of his bag, that would be a lower priority because his life is not at risk. And so, I know that probably doesn't sound very nice, but that's just kind of, as far as priorities are concerned, that would be a lower concern to some extent. We would still investigate it, but am I right in saying that? Okay, I just want to make sure. Okay, so what information is needed when you make a report? This is important information as well. So you're going to need identifying information like their name, their date of birth, their race, their address, demographic characteristics. I don't see this as often in areas like Madison County, but I know in my rural counties, sometimes you can give like directions to a house, and that's fine. Like if you don't know exactly where it is, you can give directions. But if you give directions, please don't say it's where the white barn used to be, but it's no longer there, and then you turn right at the fence that isn't there anymore, but was 10 years ago. So don't say things like that. But if you know directions to their house that are pretty easy to understand, we can do that. Okay. And you also have to give just a summary of what your concern is and who it came from. So, all right. So, what is the process following a report? Okay. So we have. We'll go ahead to this. We can screen out a report if we do not think that it meets any of our the criteria, like that's in that work aid that I gave you, we can screen it out. And so let me give you an example of one that we screened out, and one that I got a call for because they were complaining that it was screened out. Okay, so we had a mom call, and she said that they were, okay, she and her husband were divorced, so her ex-husband. Her son was living with the husband, ex-husband, and so what happened, so she called and she said that there were weeds in the backyard, like it was just overgrown, and she was scared for her son's safety because she was afraid he was going to get ticks and fleas and all these things. And so I'm like, oh, okay. And then she said the house was really dirty, and I said, okay, well, give me some more information. And I said, how old is your son? Well, ma'am, he's 17. Okay. And my next question was, is he developmentally delayed or anything like that? And her response was, no. And my response was, well, can he mow himself? Because that, we look at it, and that might sound callous, but we look at developmentally appropriate, and that is developmentally, I mean, what's the chance that that 17-year-old kid is going to go sit down in the grass? And why can't he cut it, So those are some questions that we have. Now, and I don't know if this is appropriate either, but like if they said that there was weed growing, that might be like another, that's a whole other referral. But as far as grass being too tall, we're not super concerned about that. So, and we have to find some, light in all of this because it is so heavy. So, anyways, okay. So if they're screened in, we have different priority responses. So we have 3 priority response levels. Priority 1 alleges that children may be in imminent danger. We have to respond within 24 hours or immediately, and that's just based on the supervisor's discretion, okay? Priority 2, it alleges injuries or risks of injuries that are not imminent, life-threatening, or do not require immediate medical care, and our response is within 2 business days. So, business days means if you called in on a Friday, we won't have to respond until Monday or Tuesday. So, anyways. Okay, priority 3 alleges situations or incidents considered to pose low risk of harm. Response within 3 business days. In the case that I mentioned earlier about there are cockroaches coming out of a child's bag, like I did Child Protective Services for a little bit in another county, a rural county, and that was a real referral that I had, and that was a P3 of priority response 3. Okay, you guys have, it's like a, I don't know what color this is. Coral?
Salmon.
Salmon. Mm-hmm. Okay, all right, so I think that this is a really great chart if you guys have questions about what happens with a case once DCS gets involved. It's just a flow chart. Actually, is it this? Yeah, it is that pink color. But this is a flow chart, so it kind of gives you from CPS to if we worked it or not. If we did work it, what happens after that? So it can go to foster care if the child comes into custody, or it can go to an assessment case or a non-custodial case, which means that the child did not come into foster care, but maybe they're with a relative or something like that. So, anyways, I think this just is a really good picture of what we do, because sometimes it gets confusing because there are a lot of areas within the department. So, okay, the next one. So how can the community get involved? Like I mentioned earlier, the child and family team meetings, if you are close to a student and their family and they want you to participate in a meeting, you can. And that's just you guys being a support for that family. And it's so good when we see our teachers. We've had a lot of teachers come in to our meetings, and it's been so good to see their support throughout it. Mentoring programs, there are several mentoring programs in Jackson. It's has a wealth of resources here, and you guys are so fortunate because in our outlying areas, they don't have nearly as many resources as you all do. So it's quite a great thing here. Local community outreach programs, there are a lot. RIFA, Area Relief, that's just to name like 2, and there are a multitude. So reach out to those, get involved in those. Community advisory boards here in Madison County, they have the, Ms. Teresa, do you know what date? I know they have one today. Today was Madison County. Do you know what days they usually are on?
Foster care review?
Community advisory boards.
We have a total of 11 And they usually on Wednesdays and Tuesdays and Thursdays, but I don't know the exact.
Okay, I think
calendar
today
for all
was
of
one,
them.
so Tuesday is maybe our Madison County. And it's just a bunch of, and I know that that's not gonna be applicable to you guys, but maybe in the summertime. But it's just a resource for, we pile all of the community services, we try to into one meeting, and they discuss what they have to offer for that month. And it's a really great tool that we have, so, okay. How can DCS help the community? So we have resource listings. There is a new initiative called KidCentralTN.com, I believe. I was trying to decide if it's gov or com, but it has all of the resources that we have in the state of Tennessee. We're trying to, it's probably not complete yet, but we're trying to get them all compiled into one area so that you can go and search for them and find them hopefully. So, okay. All right, so that is my presentation as far as this piece. I would like for the DCS staff to come up. I think it's really important for you guys to have faces with our staff because they're going to be in and out of the school system serving y'all. And so I just think it's really great if they, you guys can see them. So if you guys can come ahead and come forward, and you can just put that up there.
They don't want to come forward.
They're scared, I think. I'll go ahead and turn the lights on. Is that
Okay, yes, it's the switch by that door.
No lights, we can just.
You like the dark.
Ah, the lights. Okay, and what I would like for them to do, I'm gonna have them explain what they do with the department, and we're trying to be really conscientious of time as well. But I'm gonna ask them to explain what they do with the department, and if you guys have questions, we'll do that. But I'll first have them explain their roles, and then, do you want me to turn that off? Can I just put cameras?
Unplug the blue thing and, yeah.
Okay, better.
My name is Margaret White, and I am a team coordinator for the Department of Children's Services for Madison County. As Annie said, there are 11 counties in the Southwest region, and just so you can kind of get a geographics of those 11 counties, it consists of Chester, Decatur, Fayette, Hardeman, Hardin, Haywood, Henderson, Lauderdale, Madison, McNairy, and Tipton. That kind of makes up the Southwest region. I am responsible for oversight and management of 3 disciplines: child protective services, which you heard Annie talk about, and that is the whole safety component of what we do in child welfare. Foster care, that is when a child cannot be maintained in the home, cannot be kept safe in the home, and then they may come into the custody of the department. And then juvenile justice, and that is the delinquent child that if they were adults, the infractions that they are committing in the community would cause them to be incarcerated. So that is the population that I serve, and you're probably seeing my staff come to your schools and talk to you about your.
And one thing I want to interject, as far as the juvenile justice, like she said, they're the kids that are, if they were adults, would be picking up charges. But one thing I think that I want to communicate to you all is a lot of our juvenile justice kids are CPS kids, like they're abused and neglected youth that maybe didn't get into the system, maybe they didn't make it, somebody didn't report or something like that, or things are going on. But a lot of times they are abused and neglected youth, just they picked up charges before we could investigate abuse or neglect. So I just wanted to make you guys sensitive to that. I think that it's easy to see be frustrated with some of the juvenile justice. I get it. I've facilitated meetings and they can be very not nice. But what they're going through at home may be horrific, and you don't know. So I just want you guys as teachers to be sensitive to that. They're still responsible for their actions, but I do want to say that. Yeah.
And I wasn't being ugly. She's got a wedding dress fitting for her daughter to get to. So.
Okay. Thank you.
I'm Kendra Taggart. I'm the education consultant, and I hope in Madison County school systems it's not like it is in others. There's one school system that when they see me come into the window, they put out an all call to hide everything. So I'm not a bad person. I'm not a bad person. My job is to make sure that the needs educational needs of the kids in foster care are met, whatever they may be. But on the other side of that coin, I also feel like I have a responsibility to the school system, because I don't want anybody in the school system, teachers that I work with, getting into any kind of hot water to audit to whatever, because I sat back and let something happen that should not have happened, according to IDEA or FERPA or any of those kinds of things. So I feel like I'm advocating for the kids' needs, but I'm also trying to protect the interest of the school systems that I work with as well. 11 counties, I think it's about, last count I had about 150 schools. So I'm on the road, out of the office most of the time. And I have developed a relationship with people in those school systems over the last 14 years. I've been doing this for 14 years. But I'm the one that's going to be saying, okay, I need a report card. I need a transcript. I need you to enroll this child in school. I don't care if you don't have records. The agreement between Department of Education and Department of Children's Services is that these kids will be enrolled in school regardless of whether we have paperwork or not. Because a lot of times we're having to move these kids spur of the moment because of a court order or a disruption, or because there's an emergency in the middle of the night. It could be anything. It really impedes these kids' education when they have to sit for a couple of weeks waiting to get in school because somebody doesn't have a class schedule or somebody doesn't have their last report card or whatever. They're already, particularly at the high school level, they're already embarrassed, they're heartbroken sometimes, they're in crisis. There's just a variety of situations that kids can be in, and we don't need to put any other stressors on them that they're not already experiencing. So I'm going to schools trying to make sure that they're enrolled. If they're special ed, I'm trying to make sure that they have IEPs, and that the IEPs and the psychoeducationals are kept current, or they have 504 plans. A lot of times we see kids coming into custody that are special ed or should have a 504, but they don't because they've never had a parent that was involved enough to advocate for it.
And if you can we tell teachers if a child is in foster care?
We cannot give out a list to schools that says, here's a list of kids in your school that are in foster care. However, when a child is coming to the school, the case managers are supposed to be giving you an educational passport. We'll have a face sheet that it will tell if the parent is still involved. Sometimes parental rights are terminated, sometimes they're deceased, sometimes we don't know where the parent is. But that face sheet should identify who the case manager is, who the foster parent is, who the parents are if they're still involved, the last school that they attended, if they've been withdrawn, if there were disciplinary actions, medications that they're taking. There's a lot of information on that face sheet. And even if we don't have any other records on a child coming to a new school, we should at least be able to fill out most of that face sheet and then supply the other documents as we can get our hands on. Yeah.
Can you tell if a juvenile justice child has charges?
We cannot tell you the charges. There is a situation where if a child, either probation or in custody, either one, has ever in their lifetime, no matter when it happened, or whether DCS was involved at the time or not, if they have ever in their lifetime been adjudicated on certain charges, and it's the more serious charges like rape, kidnapping, aggravated sexual battery, murder, arson, robbery, those kinds of things, then I have to hand deliver to the principal of the school a letter that says this child was adjudicated on this charge on this date in this county. The principal is supposed to share that only with people at the school that have a need to know, like the instructional teachers, guidance counselor, school resource officer, whoever the principal deems has a need to know that information. That letter is supposed to be kept in a manila folder or something apart from their permanent record, apart from their special ed records, and it's not supposed to be faxed, scanned, emailed, copied to anybody, anywhere. If the child changes schools, I had to go hand deliver a new letter, but the principal at the school the child was in is not supposed to forward it to anybody. So in those situations, and only those situations, would we be notifying of delinquent offenses? And it's not all of them, it's just the more serious.
So if you guys have questions about 504s and 401s, I mean, IEPs, anything like that, you'll have Kendra's information. We'll make sure that comes out. You know, it's kind of more like to protect our kids. You know, they can't be suspended for more than 10 days, things like that. So it's a protection for our kids too, because sometimes, you know, when they don't have parents involved or the parents maybe are negligent, you know, that gets involved.
And the case managers, I'm kind of a troubleshooter because the case managers call me in when they run into any kind of a roadblock and they need my help. But if you have the child in your class that you know is in DCS custody, of course you should have the case manager's name to contact. But if there are issues educationally that are not being resolved for whatever reason, then you're free to contact me as well.
Okay.
All right. Well, that brings us to me, and I'm Leanne Ryle. I'm the Regional General Counsel for our Southwest region, which is all 11 counties. And I guess you're probably wondering, how is legal involved? Well, legal's always involved in everything. I know what people say, oh, the lawyers make us do that, and that's true, we do. But what we do, we help our social workers make sure that the department's doing what it's supposed to do, make sure that the child is protected, that the child has representation, make sure that the parents' rights have, that they are protected and that they also have representation. So one thing I wanted to make sure that you were aware of, as you are a mandated reporter, I don't want you worried about, well, what happens next? You know, what if it's not right? What if I have the facts wrong? Report it. Our investigators will investigate. If we have to go to court, we'll go to court, but everybody's on a level playing field. And that's what my staff does, is to ensure that everyone is on that level playing field so that everyone's rights are protected. Each person's represented by an attorney. And that way the court gets to have the full picture, gets to hear from the parent side, gets to hear from, in fact, the children are appointed attorneys as well. They're called guardians ad litem. And they look out for the child's best interest. They have a different perspective on everything than, say, the department's attorney does or that the parent's attorney does. So the judge gets to hear from all sides on that. What my staff does, and when we are fully staffed, when our legal staff is fully staffed, we have 8 people. There are only 4 of those that are lawyers. Right now I'm down a lawyer. So you can already tell that the math is not good for 4 lawyers to cover 11 counties. In fact, I think I've been in my office a total of 15 minutes today.
So we're very thankful she's here today.
Well, I always enjoy coming, and like the communication is so important. I wanted y'all to understand, as educators and as parents, that we are looking out for each person's rights. My staff is very sensitive to that, to ensure that that there are, like I say, guardians ad litem appointed for each case, and that each parent has that opportunity to either have counsel appointed to them. If they can complete an affidavit with each court, and the court will determine based upon their income whether or not they are entitled to have an attorney appointed to represent them. If they aren't found to be indigent, then they do have that opportunity to consult with counsel to hire their own attorney. So everybody does have that opportunity to be represented by counsel, and we assist, our legal department assists the social workers in ensuring that children do find a safe place to be, that they find permanency with someone. If they can't be with their parents, then with relatives or through adoption or through subsidized guardianship. And so there's something else I wanted to share, and it's just left me.
While you think, I'm going to ask, because I know teachers want to know, if I make a report,
That was what I wanted to
what
know.
happens?
When you report, you can do so anonymously. You don't have to give your name. What the department is instructed to do, what the law is, we cannot reveal the identity of the referent. Period. We can't reveal it. Sometimes people think they know who the referent is.
And they will fish for information, and they will tell you that somebody told them, but we are not allowed to.
We don't tell. And they do fish, they think they know, we tell them, I'm sorry, I can't reveal the identity of the referent. And we don't identify them. I can think of only one case. I've been with the department. Thursday was my 14-year anniversary. I can think of one time in 14 years where a court required me to reveal the identity of the referent. And it was an unusual situation. And it wasn't an educator. So But that was the one thing.
Okay, good.
Anybody have any questions about the legal process? We may see you sometimes. We'll send you an invitation, perhaps, to come forward.
Lovely.
Thank you in advance for coming and for sharing your knowledge, because, as I think Amy said earlier, it's so important. You see, and as a parent, you see our children sometimes more than we do. And you see them, throughout the entire school day, and then you send them back home to us. So I appreciate what you do and how you keep our children safe, and I thank you for being a part of the process.
Danica.
You can say it. I'm Danica Glenn, and I'm a CPS investigator. I don't know if you recall Annie Ross saying earlier that we have investigators and we have assessment workers. The only difference in assessment workers and investigators is the severity of the case. Of course, the child fatality or near death fatality or all sexual abuse is considered severe, so those automatically come down the investigative track. There's a difference in time frames. Assessment workers can have their case 120 days, while we only can have ours 60 days. When it is severe, we do work along with law enforcement. Most of the time, well, I'm not going to say most of the time. When school is in session, the best place to see a child is at the school, because when we get a referral, we don't know if this is somebody's just doing something out of spite or it really is something. So we want to interview them in a neutral setting. So when school is in, that is our neutral setting, just to make sure it is safe for them to go home. I know another thing is, we go into some schools and they may say, well, the guidance counselor has to sit in. We cannot have guidance counselor and people sitting in on the interviews with the children. One example would be, someone sat in once before, it's been a few years ago, in the school, and that guidance counselor knew the parent and called the parent and told the parent everything that the child had said or the questions that was asked. So we cannot have people sitting in on the interviews.
And that's based on the law. Let me interject, because of the confidentiality of the entire process. It breaches confidentiality if anyone sits in on that interview.
And then we've also had, when we make contact with a child, we are supposed to make contact with that parent that same day to let them know we have been to the school, we have this case. There has been times where the school has called the parent after we have left and said we have been there. So now they're upset that somebody has been to the school versus allowing us a chance to go to the home and let them know that we have been there. So it's best not to call the parents. And then sometimes you might even alert them to correct whatever the problem is we were there for. So.
Danica, say I'm a teacher and I have called and called and called, and you're not returning my phone call. So, kind of.
I don't do that.
Yeah. But seemingly, I'm not getting a response from the department, and I don't know why. Are you just sitting in your office not doing anything?
No, we're not sitting in our office not doing anything. I'm gonna say daily. Yeah, well, it's all about your schedule and how you organize and do things. Most of the time, we're out all day. Sometimes, I mean, it's just about every day. The third day is that we have to say, look, I'm gonna stay in today because I got work I need to do instead of going out and field. But we're in it. But we have cards, and on our cards, not only is it our office phone, but our cell phone is on there as well. And sometimes I tell, just don't even call the office, just call the cell phone if you need me. Because if you call the office, I'm not there, and then some people actually think we're there and we're not calling them back. We do have days we're off, and some people think 2 or 3 days gone by, I haven't heard from them and they're getting upset. Well, sometimes we're off. We have a supervisor that you can contact as well. If you don't know who the supervisor is, you can always call and say, this is my worker. Who's the supervisor? I haven't been able to get, my worker. And they can forward you to the supervisor. Maybe she can let you know where we are, what's going on with the case. So it's not that we're just ignoring anyone. We're in and out quite a bit. And then when school is in, like I think Leanne said it, the kids are in school a lot, so you all see children more than their parents do. So that's why it's best, whatever you see, to let us know. We don't mind talking to the teachers or whoever we need to. Sometimes there's specifics we cannot reveal about a case, but we will talk with you all.
Our local office number, for most of our workers is 421-2000, and that'll get you to our switchboard. So if you made a call, you know that they investigated, you know, and you're not getting a response back, you know, that's a good number to call for a supervisor. I'll say this, we've asked that the region, I think, a 2-day return kind of phone call policy, if they could return that in 2 days. Our workers are super busy, they're out in the field, you know, they are in homes, in schools, they're everywhere, in court, oh my goodness, court can be
All day.
overwhelming. So, you know, just be patient with us if it's been more than a week, you know, we want to know that. If our workers aren't doing their jobs, you know, we want to know that, but, you know, allow some time for that, so.
And I just want to say, I don't mind at all if a teacher or somebody asks for my card. Usually I give my card to, if it's a teacher who made the report or whoever it is in school, I usually give them my card because I'm not trying to discourage you to make another report, but if I have a case open, it's best if you could just call and tell me what it is and what's going on. I've had cases where I gave the principal my card. Case had been closed for over a year, but she kept my card. And it was just so simple as the child ran out of medicine again. Mom hadn't got it up there. She called me. And I said, okay, I'll call the mom. I called the mom. I said, hey, he's out his medicine. You know, you need to get his medicine. And she took it. She took it right to the school. Sometimes it's just a phone call that we need to make, and you don't have to make that report to DCS. So I don't mind, even after I close the case, you can call me anytime. Because, I mean, sometimes they don't know whether is this something I should report, what should I do? I can, you know, tell you what to do so you understand better what it is you need to do. And I just want to stress again, no, we do not tell who the reporter is. Because we've had teachers that call upset me when the parent called and said, you told them this. No, like they did, they fish, they look, they think back to what just happened between
Who's
somebody.
seen the child?
Exactly, who's seen the child, because someone would say, well, I don't know, they only been to school today. So it had to come from the school.
But with that mandated reporter, there are legal ramifications to that too, of being, if you know and the child says, my teacher knew, and you didn't report, you know, that can come back on you as well. Am I right in saying that, Leanne? Like to some extent, to some degree?
To some degree, but I'm sure all these people will report what.
They will.
So
Because we came and trained you all.
And
so
err
now
on
you
the
know.
side of safety.
Yeah, err on the side of safety always. Like, I think Leanne said, you know, if you feel like something's wrong, go ahead and make the report, let us investigate it, so.
Okay, any questions?
Do you guys have any questions for any of us? You know, one of the reasons why we did this is just so you guys can have familiar faces, to come to, and if you do have questions, call. Yes, ma'am. Come on up, Ms. Teresa.
I wasn't a part of the team that's been going out and presenting to the different schools. And if I could just tag along today, so that's why I didn't come down. But I would, because I wanted to certainly allow the presenters enough time, you for questions, and also keep in mind the time of the length of the presentation. But I did want to make 2 or 3 comments. One is particularly with the CPS, Child Protective Services. We have a new department. It's called the Office of Child Safety, and Vanika is part of that department. That department has its own commissioner, Dr. Scott Modell, and it filters down into the different regions. And the Office of Child Safety has all of our investigators, and that's what Vanika is. And our investigators are our first responders to any of our calls. Then, along with the programmatic department, which is the department that I'm over, we have the Child Protective Service assessment workers. And the assessment workers also are able to respond, but they work more in depth with the children, and they are not generally the initial responders. When you call in your referrals to the intake hotline, they determine which track those referrals are going down, if they're going down the investigative track or the assessment track. But that occurred in, I think, October of last year, and it'll be a year old coming in October of this year. And of course, staff are coming out to assess and see how we're doing in that area. It didn't really affect you guys that much, but it did affect the department as to how we respond. And another area that we're making great improvements in is all those investigators are going to what they call, is it the TBI Academy?
Yeah.
Have you been yet?
I haven't yet.
Okay, but she's going. And that's what it is. It's set up by law enforcement and a specialized group of people who are training these individuals, highly training them, so that they can more effectively respond to all the referrals that are called in. Because the main thing we want to do is keep our children safe, keep our communities safe, and reunite our children we hope with their birth parents, but if not, certainly make reunification a major priority for the department. Commissioner Jim Henry is very, very proactive in this. We meet with him every Tuesday morning for a 1-hour call, and that's all the departments have to report out to him exactly what we're doing. And he asks very specific questions. So he's very hands-on, he's very involved, he's very much involved with the communities. I'm also on the 3 Branches Institute, and that's a fancy name for executive people who get together. Judge Christy Little is kind of chairing that one, this cycle that we're going through now, and she's very much interested in meeting with schools. I'm also on another committee with the superintendent, the mayor's, I think, advisory council, with your superintendent. I'm on that committee with her, and we're all about trying to keep our kids safe, keep our communities safe. We're very, very much interested in the education of our children. And in this particular county, I think our custody numbers for Madison County is somewhere around 115, 120. But we work extensively with non-custody children also. It's not just children who are in state custody. We spend equal resources and energy on a non-custodial basis, and that means that anybody that needs help, just like what Vanika said before, they've been in custody, came out, the mother had maybe 5, 6 months down the road, the mother had some more problems. Vanika handled that non-custodial, that's what we call non-custodial. She just reconnected with the mother, got her some services, and we're able to still, assist the family. We got a very large grant. Southwest region didn't get much of the money because our custody numbers are so low. Right now, our custody numbers are at 391. We have some counties that have custody numbers 8,900. But everybody's working to get those numbers down. But there is much more money available to work non-custodially with families to get them the services that they need. So sometimes when you call in a referral and it's screened out or whatever, we can still work with that family if they need help. So I'm not going to say any more, and I want to allow time for questions. I can go on and on. But if y'all have any specific questions with the Department of regarding the Department of Children's Services or referrals that you call in, or we hear frequent comments from the school system, like when you call it a referral. When's something going to change? Probably a referral 3 weeks ago and I don't see anything happen. You may ask those type of questions. But once the referral comes in and it's assigned to the worker and they start working with the family, they do start working. We have time frames that we have to abide by, and they do start working immediately with the families. But sometimes we get resistant families in the school system. We get resistant families to the services that we want to provide to their children. So we have to all work together. Sometimes we have to involve the court. We work with law enforcement. Of course, we work with our mental health community. We work with all type of people to ensure that we are providing the appropriate services to the children and families. But is there any questions that you guys want to address or ask? Did I understand all these are brand new teachers?
Well, for our district, many have taught in many other places before, so this is good information though for all of us. I think it's appropriate.
Yes.
I think we need it.
I know you said we call it anonymous.
Correct.
I know you said get your principal involved, of the school. Is that always good?
To get the principal.
I know you said it's just for that support, but sometimes do you think that's always good? Because sometimes your judgment could be changed by what your principal may think. I'm just asking.
And then there may be policies too that the school, each individual school may have a policy on how they handle that.
Right.
Yeah, I would talk to, or at least look at your policy and procedures manual, just to see what it says in there. Because my sister works for Crockett County Schools, and I think that their policy is
Required to. Now, I don't have anything to refer anybody.
But another response to your question, just like Andy showed on the slide, reporting is, all of us are responsible for reporting. And sometimes that report does not mean you have to consult with anyone else. And a referral is a concern that you have with the child. You see it, you think about it, and you think this needs to be investigated.
Because your concern might not be the same perspective as another person's concern, that's why I was asking.
Correct.
Well, my mother always said there's more than one way to skin a cat. So, you know,
There's always more than one side.
if you're, I would say, and I've run into this before, if you're meeting with resistance at the school, but you feel in your gut that there's something going on, there's nothing to keep you from picking up that phone when you get home and calling and reporting anonymously.
And I will say, there's actually a new system that we've implemented, where if you provide your email address, and you make a referral, they will send you an email with intake ID, and it will tell you if it was screened in or screened out. So there is some good and not good, well, I mean, it helps you know that we did our, you know, what we said we were going to do. So you can get that, and I think it actually even provides you, if I'm not mistaken, it provides you with the case manager's name and their supervisor's name. It was what Mary Beth had sent out. So I'm not super familiar with that yet, right now, but I'm pretty sure that that's. So there's some good to that. You can also provide your address and they'll send it to you, so.
Since you don't have any questions, I would say, this is what we would like from the school system. You guys not asking anything of us, we do have a request from all of our school systems. One is our educational records. We desperately have to have those for many, many reasons, especially with the specialized foster care review boards, and just in general, because we're very concerned about the education of our youth, our children in custody. We're trying to improve the rates of children who, when they turn 18, have at least a GED or a high school diploma. We prefer the high school diploma, but we want them to have something. And that number across the state, we get those figures all the time. It's really, you know, the percentages are low. We have kids 18, 19 still classified as 10th graders. And we know a lot of that has to do with their moves. They go from county to county sometimes because of the situation that they're in and placement options that we have available. Some of them we have to place out of county a lot. So we're trying to track and keep up with all those school records. Sometimes, you know, we don't do the best job of that, but that is an area that we're very much interested in. Another is involving our resource parents. A lot of our kids are placed, we have 150 DCS, Department of Children's Service Resource Homes here in the Southwest region. And that doesn't even count all our private provider homes.